About time.
Hi, I'm going to be the nurse taking care of you today. My name is Sahara. Are you feeling any pain? I saw a call light go on.
Yes, it hurts like crazy.
It hurts? Can you tell me where?
It hurts mostly in my back, not as much as down my leg as it did when I came in. But it hurts. My back hurts. Just hurts.
Okay.
It feels like I
Okay.
hit it with a hammer or something.
Okay. Can I lay you back down? Will that help a little bit?
I don't know.
Okay, I'm gonna try. We're gonna try that. Okay, Chuck?
Okay.
How's that?
Not fast. Not fast.
Okay. There you are. All right. So you are gonna be due for some pain medication soon. In about 15 minutes. I'm gonna try to get that up for you, and we'll go from there. In the meantime, I want to check your vital signs.
Okay.
Okay. Give me 1 second. I'm gonna get that for you. All right, Chuck, so I'm just gonna check how you're breathing, how your heart's working, because when you're in pain, sometimes that gets compromised, okay? All right.
What's this?
This is gonna check your oxygen.
Okay.
Okay, just go ahead and take nice deep breaths if you're able to. Okay. Now we're gonna check your blood pressure. Just gonna go right around the arm. There you go. And I'm going to listen. Go ahead and relax your arm. I'm going to listen to your lungs real fast, okay? Are you having any problems breathing?
No.
Okay. Take a nice deep breath. Okay. Okay. All right. So it could be, we're going to go ahead and get you pain for that location, but also you just got back from anesthesia or from surgery yesterday. So anesthesia is wearing off, which is why you're feeling all that pain. I have to check all your vital signs to make sure that you're good to go with more medication on board, because these are heavy duty narcotics.
I'm sorry, this hurts.
Okay, all right, so I'm gonna go ahead and get that medication. In the meantime, when I listen to your lungs, Chuck, it's not as good as I want it to be, and your pulse oxygenation is not as good. I'm gonna give you this little contraption. Did they talk to you about it? So when they gave you all that anesthesia, it kind of shuts down all your organs, one being your lungs. When you're not getting all that oxygen, you're feeling pain. So this is called an incentive spirometer, okay? And when you can, you're going to be inhaling on this a couple times, and you're gonna try to get this little yellow thing to go up, okay? Would you like to try it? I'm gonna have you sit up a little bit, okay? We're gonna stabilize this area. You're gonna sit up slowly. There we go. You're doing great. You're doing great. Is that okay? Okay.
Yeah, it'll be okay.
Okay, good. Take nice deep breaths because you're holding your breath, and that's kind of giving you a lot of issues also, okay? Okay, here we are. So this is your contraption. What you're gonna do, you're gonna inhale into it. And you're gonna try to keep this yellow thing right into this bar area right here. Okay? And the goal is to wake up those lungs so you get oxygenation. Good, you're doing great. Take some practice.
Stay up there?
Yep, try to keep it up there. Good job. Good. There you go. So you're going to try to do that on your own time, so that way your lungs wake up a little. Okay? I did hear a little bit of crackling in your lungs, so that way we can get that. And I'm going to go ahead and meanwhile get that medication. While I'm here, before I get the medication, I would like to just assess the area to make sure it's not infected. Okay? And just a little peek at your surgical site. Now, I'm just looking at the pain is right here on your right hip, correct?
Yeah.
Okay.
It's just a little higher.
Okay, so I'm taking a look. Okay, does this hurt?
No.
On a scale from 1 through 10, or 0 to 10, 0 being no pain and 10 being the worst pain you've ever felt, can you tell me what's the scale?
It hurt really bad when it happened, so it's not a 10.
It's not a 10, that's good news.
Maybe 6.
6.
5, 6.
Okay, and what's your tolerable level of pain?
If I'm going to say 4 maybe.
4, okay.
We can do 4.
Okay, sounds good. All right. So I'm taking a look at it, nothing is infected, it's just, of course, you just had surgery, so that's why that's painful. Okay, so that's reassuring that you're hanging on in there. Do you have any questions for me, Chuck, before I get your medication?
So, how long am I before I can get up, do you think?
Well, you are actually on bed rest for quite a while. You just had spinal fusion. So for the next 72 hours, you are non-weight bearing. Meaning, if you have to go to the restroom, you'd have to let me know. I gotta give you a urinal or a bedpan. Do you feel like you have to go to the restroom?
No, I'm fine.
Because I can get you that.
That'll wait.
Okay. And also, you have all the nutrition you need right now. You are NPO. Just in case you need to go back to the operating room, meaning you can't have anything by mouth, just water.
What a thrill. Okay.
Okay, so I'm gonna give you some of that water, and then let me know if you have any other questions, okay?
All right. How often am I supposed to do this?
Every hour or so, if you wanna breathe into it about 6 times,
Okay.
and that's just to loosen up your lungs, because I'm worried that your oxygenation is not as well as we want it to be.
Okay.
Okay, here's some water for you. Is there anything else I can get you before I go ahead and get that medication?
No, I think this is probably, no thanks.
Okay, so I'm gonna be checking on your oxygenation periodically also, Chuck. This is just a little apparatus, just in case you need some supplemental oxygen later. I can go ahead and give that to you. And I'm just gonna go ahead and look through your chart to see what else doctor's orders will be.
Okay.
Okay? Perfect. Are you having any other pain besides your surgical area?
No, my leg's kind of numb, but it doesn't hurt, it's just tingles a little bit.
It's a little tingly. Okay, well, I actually want to check up on that also, just to make sure that we're not cutting off circulation to the area.
Okay.
So I'm just gonna check your pulse right here on your foot. Can you feel this, Chuck?
Yeah.
Yeah, you're kind of tingling. Is that feeling funny?
Now that I know you're doing it, it was okay. I just didn't know what you were gonna do, and it was surprised me.
Okay. Well, I'm gonna check the other side.
Okay.
Check your pulse. Okay, good. You do have some pulse, so that's good. You're getting circulation. Can you feel your toes?
Yeah,
Okay. All right. Okay. Perfect. So before I step out, I just wanted to let you know, your call button is right here. There's a red button. If you need me, you can go ahead and push that button.
yeah, I remember doing that. I'm glad you came. Thank
Okay, good. Okay. Well, if you have any questions, let me know before I take off.
you. No, I think this is fine.
Okay, sounds good. Thank you, Chuck.
Uh-huh.